Swedish's mission is to improve the health and well-being of each person we serve. Patient-centered care is central to this mission, where every patient receives not just treatment, but compassionate, world-class care. Philanthropy is about real people. Real lives are changed because of generosity. These stories show how donors' contributions don't just support Swedish as a healthcare system, they make a difference for individuals and families facing some of life's most challenging moments.
Our daughter Alexa was born at 3 pounds and then promptly admitted to the NICU. We were very fortunate in that we lived downtown Seattle at the time and could come back and forth. You know, I saw families that had come from Alaska or, areas further away from the hospital. It's hard to be that far away when you don't know what's going to happen with your child. And so I really wanted to think about how could I provide a better experience for parents that are going through this after me. And that's when we started to talk to Swedish about helping to develop rooms where parents could stay overnight.
Generosity empowers caregivers to deliver the highest level of care, expand access to critical services, and drive the next generation of medical breakthroughs.
So I think an amazing example of philanthropy is really the Paul G. Allen Research Center. Mr. Allen received his care at the Swedish Cancer Institute and in his gratitude left a large gift for us. And the only thing he said was to make the care better for the next patient.
Philanthropy ensures that Swedish remains at the forefront of patient-centered, leading-edge medicine.
Back in 2020, my dermatologist recommended that I take a genetic test to see if we can identify if there were any genetic markers associated with a skin condition that I have. Fast forward to 2023, I had started to experience some breast pain. And then it came back that I had invasive carcinoma in my left breast. Because I knew my risk, I really do think that the genetic test saved my life.
Giving is part of our DNA, and it has allowed us to become the amazing organization that we are. Support doesn't just fund programs, it transforms lives.
And one of the early things that we did with philanthropy was to give scholarships to trained doulas of color. There were a lot of women of different ethnicities who didn't have the same cultural support as white women did.
When I first came to the MS Center, I was not in a good place. I needed a cane to walk. I started a mild program of exercise, chair yoga. I was able to get stronger and stronger and stronger and eventually not need the cane anymore. And I'm very, very grateful to the MS Center for caring for me.
So what has philanthropy enabled us to do in the Swedish Multiple Sclerosis Center is to learn through research what works and maybe discover what should work better.
Life isn't all about taking. It's about sharing and being part of the community and helping others. And nurses are very, very special people. So when a person wants to be a nurse, I think it's our job as citizens to help them as much as we can and let them know you care.
That's what I wanted to do. I wanted to get that word out, raise money for genetic testing. So I organized a fundraiser with my gym.
You know, the doctors and nurses here were absolutely amazing. I'm so grateful. It's why I am so passionate about giving back. People took care of me. How can I take care of them?
Together, we can expand access to compassionate care, push the boundaries of innovation, and improve the health and well-being of each person we serve.
As Chief Philanthropy Officer of the Swedish Foundation, I want to thank you. Whether you've already given or whether you're considering a gift, your generosity makes a real difference. Together, we're pushing the boundaries of what's possible in patient care and shaping the future of healthcare at Providence Swedish.